Estamos en el Congreso ESMO de Madrid, la rueda de prensa de Eisai sobre la Eribulina y la doctora Galina Velikova, profesora de la Universidad de Leeds. Primero, ¿qué es Eribulina?
What is Eribulina?
Eribulin is a chemotherapy drug, a cytotoxic drug, which can be used in the treatment of breast cancer, and it's an active drug in metastatic breast cancer.
Ahora está en el estudio fase 3.
Right now it's in study phase 3, right? Study phase 3 right now.
Yes, yes.
And
Los principales avances.
which is the principal advance? What we
What
find?
is the principal advance? Okay, so there have been 2 phase 3 studies of Eribulin. One called Embrace, where Eribulin was compared with treatment of physician choice in advanced breast cancer, which in patients who previously have received 2 or 3 different treatments for advanced breast cancer. And the other trial is called Study 301, where Eribulin was compared to another chemotherapy drug called capecitabine in patients who had at least 1 prior treatment. So this is earlier in the treatment of patients with metastatic breast cancer. And it's worth saying here that these patients often receive 2, 3, 4, 5 different chemotherapy treatments over several years.
¿Cuáles serían los principales efectos adversos?
What are the principal effects adverse against?
Yes. So in the analysis of those 2 trials, one of the trials showed significant benefit for patients who lived longer when they received Eribulin by about 2.5 months. And all chemotherapy drugs have side effects. The main side effect with Eribulin is it lowers the white cell counts in the blood, and these are the cells that fight infection, so there is a high risk of getting infection during the treatment with Eribulin. However, the studies showed that although the white cell count drops, there isn't a higher rate of infection in these patients, so the white cell count recovers. The other main side effect is tiredness, which happens with a lot of chemotherapy drugs, and it also can affect the nerve endings. It's a condition known as peripheral neuropathy, where patients feel numbness, pins and needles of their fingers, and that was another side effect of Eribulin observed.
La eribulina está dedicada a...
Eribulina is dedicated
al cáncer de mama.
It's dedicated to the cancer of mama.
Yes,
¿Cuál
it's
es
for breast
el
cancer.
principal impacto en la quality of life?
What is the first impact on quality of life?
Of Eribulin
Yeah.
opera. Well, the metastatic breast cancer is a condition which is not curable. We can treat it with different drugs. Patients with that condition often have worse quality of life. They may have pain, they feel tired simply because of the cancer. And when we treat the cancer with effective drugs like Eribulin, we control the symptoms from the cancer, and patients can feel better despite the side effects of the drug. So it's quite important in that treatment area to achieve that balance between controlling the cancer with the chemotherapy and, despite the side effects, make people feel better. And I think this is where the quality of life study in the Eribulin trial is important, because it shows that despite the side effects, quality of life of patients is maintained, and in some patients it improves.
Thank you, doctora Galina Velikova.
Thank you.
You're welcome.